Hello, good morning. I'm Dr. Teo Wan Lin, a board-certified dermatologist, and I practice at TWL Specialist Skin and Laser Center. Today is World Skin Health Day, and first of all, I would like to thank the organizing committee for inviting me to be part of this wonderful series of talks by my fellow colleagues on important dermatology-related topics. I will be speaking on the topic of Maskne. What is it? And also how to treat it. I'm sure many of you have heard of Maskne, but here's a little bit of background as to what exactly it is and how dermatologists approach it. Maskne is a term coined during the COVID-19 pandemic as a specific form of acne that occurs over the part of the face covered by the face mask. Well, this actually is not a novel condition. Rather, it is a form of occlusion acne or acne mechanica, which had previously been reported in individuals who had to wear, for example, headgear, sporting helmets, and also in healthcare workers who were used to working with infectious disease patients and needed to wear the N95 mask for long hours. Now, essentially, Maskne develops when there is a change in the local skin environment. We call that the microenvironment. The key here is that there is a good balance of bad bacteria as well as healthy bacteria that lives on everyone's skin. When the skin microenvironment changes, it has the ability to affect the composition of good and bad bacteria. So with Maskne, this is exactly what happens. The microbiome is disturbed, and that's when individuals who previously did not get acne may find that they start developing acne. There are also those who already suffer from acne. It may be mild, and they find that their acne gets much worse with the wearing of a face mask for long periods of time. So what exactly is happening here? Essentially, when you occlude the skin with a face mask for long periods of time, it increases the humidity and it allows accumulation of sweat and saliva. For example, when you're speaking, it inadvertently gets onto the face mask. That together with Singapore's climate, which is very hot and humid, all that creates the perfect microenvironment to breed bacteria. Acne itself is directly linked to bacteria. You may have heard of P. acnes, Propionibacterium acnes, and that has been identified as the main bacteria that causes pimples in individuals who are genetically predisposed. We've always spoken about acne being mainly a genetic condition driven by inflammation. But we also know that the presence of this bacteria on the skin of acne sufferers actually is directly responsible for acne flare-ups. Now, in the case of Maskne, it directly impacts the rate of growth of these harmful microorganisms in skin. At this stage, many of you may be wondering, how do I know if I have maskne, or is it skin sensitivity or any other form of skin condition? That's a really critical question, and it is important for you to note, first of all, that many of these conditions can only be distinguished by an accredited dermatologist. However, these are some basic guidelines that may help you to figure out if you may have maskne or it could be something else. The definition of maskne is essentially the onset of acne pimples over the area occluded by the face mask within a period of 4 to 6 weeks after starting to wear a face mask. Essentially, this is based on the principle that acne doesn't appear overnight. The process known as comedogenesis, comedone formation, is actually the scientific way dermatologists explain how pimples occur. You may have heard of blackheads, whiteheads, but before they appear on the surface of your skin, they're actually existing as microcomedones. Microcomedones, they are at the bottom of the skin layer, and that when they arise to the surface, that's when you develop a visible blackhead or whitehead. This is also when it can get infected with superficial skin bacteria, and you can get red-looking angry bumps known as papules. It can develop into a cyst, which is often a larger bump that is painful, swollen, and often requires treatment, say with an injection by a dermatologist. Or it can also develop into a pustule where you see bits of pus at the surface of your skin. So the key here is that maskne doesn't look at all different from regular acne. Apart from the fact that there is a history of mask wearing, and also the location where it develops. In this case, we describe that as the ozone, the area conveniently attributed to the part of the face that is covered by a face mask. This is useful for dermatologists because traditionally we do describe the distribution of acne being slightly different in acne sufferers. For example, many of you may have heard of the T-zone, which is the area over the forehead and then to your nose and the chin area. That is the commonest area affected when it comes to physiologic acne, which is teenage acne basically. The U-zone, the area around the jawline, has been associated more commonly with adult acne sufferers. It's also linked to the term hormonal acne, but there isn't really a big difference in terms of how and why these acne bumps form, other than the fact that in hormonal acne, there could be, in certain cases, a condition known as polycystic ovarian syndrome. Short name for that is PCOS or PCOS. It occurs in adult females who may also have irregular menstrual cycles and increased hair growth, condition known as hirsutism, as well as adult onset acne. Maskne, in this sense, can overlap with these different types of acne. It is important and interesting for us to touch on some conditions that can be mistaken for maskne. We're going to start first with dermatitis, better known as eczema. Facial eczema is a condition where there is increased redness, flaking. There could even be skin swelling and some bumps occurring over the area that's covered by the face mask. There are actually many factors that increase your chance of developing facial eczema when you wear a face mask. And these would be the very fact that the face mask covers your mouth and your nose. In this case, we wanted to stop the respiratory droplets from excessively disseminating to your environment. And hopefully that reduces the transmission rate. But the very fact that your salivary and nasal secretions get on your skin is not actually a natural or normal thing that happens all the time, and this is why it causes problems. The saliva, for example, contains digestive enzymes that's meant to help us digest our food. But when it is coming in contact with your skin, and prior to the COVID-19 pandemic, we would see that most commonly in young children, toddlers, who drool, and that would lead to irritant contact dermatitis forming on the surface of the skin where it's always in contact with saliva. So in an adult who has a family history or personal history of sensitive skin, allergic nose, sinus problems, they may have what we call atopy, which is a constellation of symptoms that increase your risk of developing skin conditions like eczema. And that ultimately boils down to the skin barrier being deficient. So you can imagine the process as when your saliva comes into contact with your skin, the salivary enzymes are actually partially digesting the superficial layer of skin cells. And over time, with the increased accumulation of sweat, bacteria, humidity, and occlusion, we know that overall it does increase your risk of developing facial eczema or dermatitis that can appear specifically over the area covered by the mask. Another condition that can be worsened by mask wearing, but is not itself maskne, is rosacea. Rosacea is a condition where the skin's blood vessels are hypersensitive and it expands excessively and persistently in response to heat, spicy foods, emotions, and it can reach a state where even in the absence of these triggers, skin appears persistently red. There is a direct correlation with the symptoms of rosacea and mask wearing, which leads to occlusion. As we discussed earlier, occlusion itself creates a rather unnatural and we know is unhealthy skin and microenvironment, and there is research that explains to us how in conditions like rosacea there could actually be a disturbance in the skin microbiome itself. So this is another reason why we may observe worsening of skin conditions that are not maskne over the area covered by the face mask. I want to touch on something known as frictional dermatitis right now. And it will take us to important factors that influence whether or not you develop skin problems when you wear a face mask that's related to the design of the face mask itself. The constant contact of the face mask with various parts of our face, especially when we're wearing it throughout the day, while going about our daily activities in indoor environments, actually creates friction. And for areas like the face where the skin is slightly thinner and more delicate, it can lead to dysfunction in the skin barrier. We spoke about dermatitis earlier, but the very fact that we have to wear the face mask throughout the day creates a new issue, and that's not just relating to the microenvironment with the humidity, the bacteria, but also mechanical forces of friction. So that brings us to the topic of how our face mask design can influence the development of these various dermatological conditions. In the case of maskne and facial dermatitis, facial eczema, we would do well with a mask fabric that is breathable. Traditionally, we spoke about natural fibers such as cotton, linen, and silk being the most beneficial for skin because of its ability to wick moisture away. And while the surface of the skin does not really breathe as our respiratory system does, it is a good descriptor of what we hope can help to improve the local skin microenvironment in terms of allowing airflow and preventing humidity and moisture buildup, which can increase the growth of harmful bacteria and other germs like fungi. However, the major problem with these natural fibers is that they are not waterproof, and this is the very reason why when we talk about personal protective equipment, we're not dealing with natural fibers, but rather synthetic materials. Your N95 mask, the surgical mask, these are all synthetic and derivatives of fibers such as polyester. The water resistance is a critical part of your mask design. We're not wearing the face mask just to be compliant with local laws. We want it to reduce infectivity of the disease within the population. And in the case of personal protective equipment, we actually hope that it can prevent infection risks, especially with a highly transmissible virus such as COVID. What are biofunctional textiles? Essentially, these are engineered materials that have beneficial properties for skin, specifically the skin microbiome. We know that there are naturally beneficial properties of a textile such as silk on skin because of its metallic content. It contains copper, for example, that is produced by the silkworms as they spin the thread. And what is being done in the field of biofunctional textiles is essentially incorporating these metallic nanoparticles, it could be copper, silver, zinc, into synthetic materials so that while they retain the properties of being highly durable, as well as being waterproof, they also have these added bactericidal benefits. Bactericidal means that it kills bacteria on contact, and that is something that has been proven with copper nanoparticles, for example, and silver. So copper and silver have been used in the development of textiles as adjunct treatment for those with eczema, for example, and it has been shown to be effective in terms of improving their quality of life as well as symptoms with use. And it really helps by treating the skin microbiome. So you may have heard of this term in the media, but the microbiome is truly an important area of dermatology research and treatments. And it is no longer about us developing more powerful antibiotics to treat disorders such as acne or rosacea, because we know that the inherent problem is that it develops, the bacteria develops resistance, and the root cause of these conditions isn't really a pathogenic infection or a bad infection, but rather a problem with there being an imbalance of the good and bad bacteria. So biofunctional textiles hold promise in terms of treating this sort of microbiome imbalance. In this last part of my talk, we're going to be discussing how you can manage mild symptoms of maskne and hopefully even prevent it. First of all, the design of your face mask does make a difference. Many of us opt for reusable face masks because it's just not eco-friendly or sustainable to be using disposable PPE, although one must carefully consider the risks of infection and transmission, given that we are seeing new variants of COVID, as well as increasing knowledge about long COVID symptoms as well. However, from the pure skin perspective, you can consider these factors. First of all, one that can stay in place when you are speaking, especially because we are wearing masks throughout the day in indoor environments, is going to reduce friction on skin, as opposed to an ill-fitting mask that you constantly have to touch and adjust. And certainly that's very bad for from an infection point of view, infection control point of view as well. The other factor that you should think about is the material of the face mask. And it is firstly important to not wear cotton, linen, or silk face masks, because these frankly are not going to be as effective as one that is water resistant. So synthetic material is actually preferable, but then you have to consider the downside, which is everything we discussed earlier. And this is why you may consider newer textiles such as biofunctional materials. Finally, if you have the odd one or two pimples that come up, say at a certain time of your month for ladies, that coincides with your period, you should use a good pimple cream. Avoid highly irritant pimple cream ingredients such as benzoyl peroxide. Retinols are sometimes found in over-the-counter acne creams. These are very irritating for skin. So the key here is that we are managing a different type of acne, maskne, because you are constantly wearing a face covering, which means whatever you apply on your pimple is going to be absorbed much more. It is a phenomenon that occurs under occlusion, which is when the skin is, in a sense, suffocated. That increases the irritant potential of benzoyl peroxide, which itself can cause skin irritation signs such as redness, flaking. So there are active ingredients without irritation that can be effective for the treatment of acne as well. So botanical ingredients that suppress inflammation, these can be useful in the treatment of Maskne. Another thing that you may have observed is your pimple cream can actually bleach your face mask. So this may come as a surprise for many, but the reason behind this is the benzoyl peroxide content that can bleach textiles. So I think it's very important for all of us to appreciate the value of a good skincare regimen for acne sufferers and those who want to prevent Maskne. And the basics of that would be an antibacterial face wash that's also gentle on skin, natural antibacterial derivatives such as medical grade honey, even soya-based emulsifiers. These tend to be less harsh on skin than chemical antibacterial agents such as triclosan, which in the very long term also has some concerns with regards to whether there are potential side effects on, say, the hormonal axis, and we certainly don't want to breed more drug resistance. The second tenet of good acne skincare would be using an effective pimple cream, which we spoke about earlier. Now, moisturizer is also important. If you suffer from oily skin, you may want to use a serum or a lotion which is lighter than a cream. Now, when do you need to seek medical attention? If you have a pre-existing skin condition that has worsened after mask wearing, then you should see a dermatologist, because in many of these cases, whether it's facial eczema, acne, or rosacea, you do require treatment with prescription medication. If you have mild acne, which is getting a little bit worse, but still not severe enough that it is causing you emotional distress, you can try switching out your face mask, adding on an antibacterial cleanser, taking care of active pimples, not picking at them, using a hydrocolloid patch can help. If you have new onset moderate to severe acne, so if you have anything more than 5 pimples a month, or to the extent that you feel emotionally disturbed by it, then you may want to seek medical attention earlier. Finally, it's important to note that it is not recommended for laypersons to try to self-diagnose their condition. If you have any doubt at all, or if you have a previous history of a skin condition, then do visit a dermatologist so that you can get prompt and accurate diagnosis and start on effective treatment. So that wraps up my talk on Maskne. What is it and how we can prevent it? I am really happy to be able to share these tips with you on World Skin Health Day. And thank you all for listening to my talk.